Welcome to this Chemscape video on respirators, also known as respiratory protective equipment or RPE. If a respirator has been prescribed for a task, it is vital to follow all standards on proper selection, use, care, and maintenance. Too often people misuse respirators, and this can greatly compromise a worker's health. The effects on one's health are not always immediate, but the effects of uncontrolled exposure to hazardous substances will silently develop inside. A respirator is a personal protective device worn on the face, covering at least the nose and mouth. Its purpose is to reduce the risk of inhaling hazardous airborne particles, gases, or vapors, including dust particles and infectious agents. Respirators should only be used as a last resort when other control measures are not feasible or sufficient. Sometimes they are essential for emergencies. When a respirator is required to safeguard workers from respiratory hazards, an effective respiratory protection program must be established and maintained. There are two main types of respirators. The first category consists of respirators that remove contaminants from the air as you breathe. Particulate respirators filter out airborne particles, while gas masks filter out chemicals and gases. Air filtering respirators cannot be used in oxygen-deficient atmospheres or in unknown or IDLH conditions. This category includes PAPR, full face, and half face masks. The other category of respirators protect you by supplying clean respirable air from another source. Respirators that fall into this category include airline respirators, which use compressed air from a remote source, and self-contained breathing apparatus, SCBA, which have their own air supply. Section 8 of a safety data sheet helps you understand the hazardous substances at your work. This section includes information on exposure limits and recommends engineering controls and the type of respirator required to work safely with the product. Many factors need to be considered when selecting a suitable respirator. Some of the things that need to be taken into account include 1. Identifying the respiratory hazard. 2. The task. 3. The person or worker. It is advisable to consult a safety professional or occupational health resource at your workplace to choose the best option for optimal protection. A respirator must be suitable for the exact substance you are working with. The filter on a respirator is designed to protect you from exposure to a particular substance. For example, a dust filter will not protect against hydrocarbon vapors, and a hydrocarbon vapor filter will not protect against a toxic substance like hydrogen sulfide, H2S. Every respirator has a protection factor that needs to reduce the concentration of the contaminant to a level safe enough for you to breathe. Different types of RPE have different protection factors. A respirator is fit to the individual to function effectively. A poor fit will not protect the worker and may be uncomfortable and awkward for them to wear. Fit testing by a competent person will ensure the proper size and fit of the respirator to each worker. Many factors go into selecting a proper fit for respirators. Eyeglasses, face shape and size, and body size can all affect fit. Hot or cold working conditions can impact your comfort level and the need to wear other PPE items, such as a hard hat or hearing protection. A medical evaluation must assess a worker's ability to use a respirator before being fit tested or required to use one in the workplace. Certain pre-existing medical conditions, such as asthma or lung disease, may prevent someone from wearing a respirator. If you wear a respirator that requires a seal with your face, you must be clean-shaven where the respirator touches your face. Stubble prevents the mask from forming to your face and protecting you from breathing hazards. Many contaminants are significantly smaller than stubble and can enter the mask if there is not a good seal. A respirator can introduce additional hazards, such as physical restrictions, heat, and psychological stress. An RPE mask should seal well every time a user puts it on. 2 pressure seal tests can check the seal of your respirator every time you don equipment. This image shows a negative pressure seal check. Close off the filter openings with your palms and breathe in. The mask should suck down and stay there for 10 seconds while you hold your breath. If it doesn't, adjust the fit and try again. This image shows a positive pressure seal check. Cover the exhalation valve and breathe out slightly. See if air leaks around the edge of the mask. If it doesn't, adjust the fit and try again. Only wear NIOSH, National Institute for Occupational Safety and Health approved RPE with NIOSH safety certification markings. Counterfeit masks and cartridges exist and compromise workers' safety. Do not compromise safety to save a few dollars. If RPE is significantly discounted, it may be a red flag for counterfeit equipment. Most companies have RPE standards, safe work practices, or code of practice to follow. Selecting a cartridge or filter is as important as choosing a respirator. It's crucial to ensure that the filter or cartridge is compatible with each other and the specific chemicals or substances you are working with. Filters trap particles as you breathe, while cartridges contain material that absorbs gases and vapors. A person wears a supplied air respirator for protection against poisonous gases like H2S or in an oxygen-deficient atmosphere. Understanding and following guidelines on respirator use is a crucial step in taking personal responsibility for your safety. Best practice is to not share respirators. Not only will you be sharing RPE, but also your colleagues' sweat and body oils, which may compromise the effectiveness of the mask. If you need to wear RPE for a job, always keep it on. Even if you only take it off for a few seconds to speak, it will reduce the protection it provides. If you are wearing RPE and can smell the chemical or product, consider this control inadequate. Filters will only work for a limited time. The supplier or equipment will have instructions on how long you can wear the RPE before the filter changes. This is called a changeout schedule. Do not reuse disposable RPE. Maintain and care for your respirators by following these guidelines. Check the strap, facepiece, and seal for signs of deterioration. Replace if you notice any damage or hardening. For respirators with a replaceable cartridge, check the filter and ensure it was changed as directed by the manufacturer. Clean reusable respiratory protective equipment, RPE, after each use with warm, soapy water and rinse thoroughly. Always follow the manufacturer's guidance for cleaning and sanitizing. Proper storage habits are essential to ensure that your respirator functions effectively. Keep your respirator clean and in good condition. Poor habits can develop, such as storing respirators in your vehicle, in a toolbox, or hanging them at the workplace. It's best to store your respirator separately in a storage cabinet or a locker, away from other tools, chemicals, intense sunlight, moisture, extreme heat, or extreme cold. Respirators protect you from exposure to hazards that may be invisible, but the dangers are real. Negative health effects can take 10, 20, or 30 years to appear. Wear a respirator today so you don't need to wear one tomorrow. That concludes our presentation. Safety continues beyond the workplace. Protect your lungs in the workplace for yourself and for those you love. Please consult your supervisor for information on respirators as it applies to your job.